We continue to track the latest out of Thailand, where officials say 4 boys have been rescued so far. A team of 12 young soccer players have been trapped there for 2 weeks. There are 8 kids left to save, along with their 25-year-old coach. Crews are preparing for the next phase of the rescue operation. Those that have been brought out were taken to a local hospital. Dr. Robert Glatter is an emergency physician at Lenox Hill Hospital in New York City. He joins me now by phone. Thanks for joining us, Dr. Glatter.
My pleasure. Thank you so much.
Let me ask you, first of all, about the boys who were brought out. They spent more than 2 weeks trapped in that cave. What kinds of health issues might doctors be checking for?
Well, first and foremost, their bodies are in a state of shock. And primary thing we worry about is hypothermia. And this is when our core body temperature drops. And generally, it's below 95 degrees Fahrenheit. Typically, our body temperatures are 98.6 and above, as we know it. But when the body's temperature drops, certain functions start to decline. And one of the main functions is the brain, as well as the heart. And so doctors are very attuned to checking their body temperatures immediately when they come in and triage and resuscitating them, making sure that they have fluids, warm fluids, to obviously increase their body temperatures and to rewarm them. Assessing their mental status is of primary concern when they are first brought into the hospital.
I want to ask you more about that in just a moment, but there are, of course, several others still trapped. Does the danger increase as time wears on?
It certainly does, and there's only a certain amount of time that rescuers have. Trying to maintain their body temperature is of utmost concern, and trying to remove any pieces of garment that are wet is of the main point that we need to do and right off the bat. And I think that all of the rescuers are aware of this. The clothes that they're wearing likely for many days has moisture, so getting them dry clothing is of utmost concern, and clothing that's moisture wicking that helps to insulate their bodies. The other issue is that when you're transporting children or anyone out of caves, and there's a vertical type of element here, their blood flow to their brains can drop. So keeping them level is always a primary concern. But of these type of transports, it could affect their brain function. Hopefully, it'll be a very short amount of time that they could be vertical.
What about the fact that they are children? Does that factor in? I know you said that obviously in this kind of situation, blood flow, in addition to hypothermia, is a concern. But in what other ways does the fact that they are so young, how does that factor into this equation of their overall health picture?
Well, the fact that they're teens or children, that's all going for them because they have a very high functional reserve. In other words, as we get older and people have other medical ailments like diabetes or heart disease or kidney disease, they can't compensate as well as a child could. A child has incredible reserves in terms of maintaining energy stores that allow them to continue and basically be able to survive in such extreme conditions. Normally, we break down sugars first and foremost, and then go to fats, and then break down muscle. But children have an incredible reserve in terms of fat as well as skeletal muscle, if need be, and they are able to basically survive such extreme conditions because their reserves are so much higher when they're young.
Well, physical health, as you were noting, is only part of this. There's also the question of trauma. I wonder, doctor, from a psychological perspective, how do you deal with patients when they have experienced something like this?
Well, we try to, to really maintain the fact that they've survived and to encourage them and to let them know that we're here for them. These harsh and extreme conditions, as much as we, experience them ourselves, are different in the minds of children. And they may be more vulnerable in the short term, but in the longer term and the longer term picture, the prognosis is excellent, and we assume that they can recover, and with proper counseling, with continual love and support, that they really will come out of this okay.
Well, what do you think are the next steps? Is it likely that the kids will remain hospitalized for some time, or do you think that they'll be sent home relatively quickly?
Well, I think the picture at this point looks favorable. Many of the kids seem to be okay from the early reports we're receiving. They'll be watched for a short period of time to make sure that, in other words, that their kidney function is normal, that their lab work, their blood work reflects, a favorable prognosis at this point. As long as they're eating, their vital signs are fine, that their spirits are fine, that likely they would be released, after probably a 12 to 24-hour observation type period. Now, this, again, is based on the fact that they're doing well, and that the doctors will be very attuned to this. So I think it's a minute-by-minute assessment, day-by-day assessment in that sense.
Well, there's so much concern, certainly around the world, for the safety and well-being of these children. Dr. Robert Glatter, thanks very much, Doctor, for joining us.
My pleasure.